Hello and welcome to my channel. This is Isaac, Simple and Real. Thank you for tuning into my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel where we should talk about issues concerning averting HIV and sexual transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. It's good to acknowledge that HIV management has been advanced to a great deal, such that currently, for those who are HIV positive, the chances of them, especially those who have been initiated on care, acquiring any kind of opportunistic infection has been halted to almost a nil. Currently, most of HIV positive persons who have been initiated on care very early do not even acknowledge any kind of opportunistic infection because they are prevented and their immunity is very competent. However, there could be some kind of infection that would suggest that you be tested of HIV infection, or you could be suffering of HIV infection in silence. Number one, herpes zoster. Basically, this is a kind of viral infection that usually manifests on the skin as very painful vesicles that usually follows a certain kind of dermatome. The good thing about this kind of infection is that it is manageable with antivirals that are available, especially the acyclovir, can be treated and cured. However, if you have not yet been initiated on HIV treatment and you are HIV positive, the chances of recurrence are there. So the good thing is be initiated on ARV if you're HIV positive to avoid this kind of infection. Number two, let's talk about oropharyngeal candidiasis. Basically, this is a fungal infection that is usually caused by a fungus that we call Candida albicans and is suggestive of immunosuppressive disorder. Could be cancer, could be other kind of immunosuppressive disorders, but it may suggest that you are also having HIV infection. Remember, HIV is an immunosuppressive virus, so you could be having oropharyngeal candidiasis because of this kind of immunosuppressive disorder. And the good thing is, be tested of HIV, and if you are HIV positive, be initiated on ART treatment. And this could help you avoid recurrence of this kind of infection. The good thing about this kind of infection is that it's manageable with antifungal agents. Let's talk about another thing, tuberculosis infection. Not about pulmonary tuberculosis, but extrapulmonary tuberculosis. Although, even those who are suffering from pulmonary tuberculosis, it could be suggestive that you also have suffering from HIV infection. But for those who are having extrapulmonary tuberculosis, the chances are higher. This we are talking about tuberculosis in the joints, bones, or other parts of the body. The good thing about this kind of infection, if you are tested and confirmed to be having any kind of tuberculosis, it is treatable and curable. However, if you have not managed HIV and you are still HIV positive and you have not been initiated on ART treatment, the chances of recurring TB infection is there. So the best thing is, if you're HIV positive, start on ARV treatment. Let's talk about the last but not the least. We'll be talking about recurrent sexually transmitted infection. Science has shown us that having a sexually transmitted infection increases the chance of acquiring HIV infection by more than a double-fold. So, if you're having any kind of sexually transmitted infection, it's a higher chance for you to be tested also HIV infection. Remember, HIV is also a sexually transmitted infection. And if you can be able to acquire other sexually transmitted infection, even you can also be able to acquire HIV infection. The best thing is, if you have not yet acquired HIV infection and you have a sexually transmitted infection, you can be initiated on pre-exposure prophylaxis to lower the chances of acquiring HIV infection if you are on an ongoing risk. Also, If you have been diagnosed to be HIV positive, the best thing is get started on ART or antiretroviral therapy, so that even the other sexually transmitted infection can be easily managed and you can be able to be cured. The good thing is, if you are initiated ART early, even other likelihood of acquiring other opportunistic infection are halted. So you have a higher chance of recovery and getting a competent immunity. Are we together up to this point? Thank you. And this comes to the end of our discussion today. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is Isaac, simple and real. Thank you.